Welcome to the Deep Dive. We're the place where we sift through all that noise, stack up our sources, and really pull out those potent nuggets of insight just for you.
Glad to be diving in again.
Today, we're plunging into a question that's, well, it's as fundamental as it is personal. Something that touches every single one of us who truly owns our health. Is it a sprawling collective duty that society shares? Or, does that responsibility rest primarily on your individual shoulders, shaped by your daily choices?
Yeah, that's a real head-scratcher, isn't it? This question of where my health responsibility ends and our collective duty kicks in, it really stirs up a lot of debate.
Oh, absolutely.
And it speaks to our core values, autonomy versus community.
Exactly. So we're diving headfirst into that often contentious discussion. Should governments be the primary drivers prioritizing healthcare funding to ensure universal access for everyone?
Right.
Or should individuals bear the lion's share of responsibility for their own health through, lifestyle choices?
And it's so important to say up front.
Yeah, let's be clear. This isn't a simple either scenario. Our sources, which include everything from, national health reports to socioeconomic studies, they lay out incredibly strong, compelling points for both perspectives.
Indeed. What we're navigating today isn't a simple binary choice, not at all. It's more like a rich, complex tapestry of interconnected perspectives.
A tapestry, I like that.
And understanding that nuance, how these different threads sort of interweave, is truly key to grasping the full scope of this challenge.
That's really our mission for this deep dive. We're going to systematically unpack these differing viewpoints, explore their far-reaching implications for you as an individual and for society as a whole. Our goal is to guide you through these sources, pinpointing the most impactful nuggets of knowledge. We want you to walk away feeling thoroughly well-informed, perhaps even having a few genuine aha moments. And definitely with a deeper, more comprehensive understanding of how these responsibilities truly intertwine. So let's roll up our sleeves and get started.
Let's do it.
Okay, let's begin by exploring what our sources frame as the foundation of collective care. The compelling reasons why governments often feel not just justified, but maybe even compelled to step into the realm of public health.
Yeah, it's a big step for government to take.
It is, and this isn't merely about charity or, providing a safety net. Our research strongly pushes the idea that equitable access to medical services isn't just a nice to have, it's presented as a fundamental public necessity.
Right, not optional.
And it's not just about taking care of one person, it's intricately linked to the collective health of an entire nation. And, maybe surprisingly for some, even its economic stability.
That economic link is what's truly fascinating here, and I think often overlooked. This perspective shifts health from being solely an individual burden to, a shared societal asset.
How so?
Well, imagine a community where a significant portion of the workforce is constantly unwell due to preventable or treatable conditions. It's not just personal suffering, though that's obviously paramount. It has these cascading effects. Productivity plummets, businesses struggle, schools face increased absenteeism from kids and teachers. So investing in public health becomes an investment in the entire economic and social fabric of a nation. It's not just spending, it's building resilience.
That ripple effect is really something to consider, and our sources definitely show this playing out. They point directly to models like the National Health Service, the NHS, in the United Kingdom.
A classic example.
Right. This isn't just a public healthcare system. It's a monumental institution, primarily funded through general taxation, where healthcare is essentially free, the point of use for residents. It's a prime example of a nation committing to universal healthcare access, from a simple GP visit to really complex surgeries.
Okay, let's unpack this. How does a system like the NHS truly make a difference for everyday people, like a tangible difference in their ability to just live their lives? Well, think about it this way. The NHS and systems like it are designed to level the playing field. They ensure that basic health is not a privilege dependent on your income or your social status, but a fundamental right.
Okay.
So for someone living in a low-income area, maybe facing financial precarity, knowing that they can walk into a clinic for a routine vaccination for their child, or take that child to the emergency room after a fall without worrying about a crippling bill, or manage a chronic condition like asthma with prescribed medication that they can actually afford, that changes everything.
It removes a layer of stress, I
A
imagine.
huge layer. Without that government intervention, vulnerable populations, those facing significant socioeconomic challenges, maybe struggling to afford rent or food, would often lack access to even the most basic medical care. These systems actively reduce disparities between different groups in society.
Which is a core public health goal, right?
Absolutely. It's a core tenet. It removes a significant barrier to health that financial strain often imposes, allowing individuals to focus on other aspects of their lives, work, family, education, without the constant anxiety of potential medical debt hanging over them.
So it's about establishing this universal baseline of health. Everyone can access it, regardless of their bank balance or background. But let's imagine the flip side for a moment.
Okay.
If governments don't step in and provide this kind of support, what's maybe the most unexpected consequence our sources reveal? Beyond the obvious individual suffering, what's a societal cost that might often be overlooked when untreated illnesses become widespread?
That's a crucial distinction to make, because beyond the immediate personal suffering, the consequences of inaction are incredibly significant and far-reaching. They often silently erode the foundations of society.
How so?
Well, untreated illnesses, especially widespread ones, don't just reduce workforce productivity, they can decimate it. We're not just talking about a few sick days here and there.
Right.
We're talking about chronic conditions that prevent people from working full-time, or maybe even holding down a job at all. This creates a greater reliance on social welfare systems, diverting funds that could potentially be used for, say, education or infrastructure improvements.
Okay, that makes sense. The economic drain.
But what our sources highlight as perhaps most insidious is the increased disease transmission.
Ah, right. Contagion.
Exactly. Imagine a highly contagious illness like measles or maybe a new strain of influenza. If people can't easily access testing or treatment, or perhaps can't afford vaccinations,
Yeah.
these illnesses can spread like wildfire. They don't just affect individuals, they impact entire communities. Children miss school, parents miss work, businesses slow down. Suddenly, a local outbreak can spiral into a regional or even national crisis, overwhelming hospitals and potentially paralyzing economic activity.
And we saw this so clearly, didn't we?
Undeniably. During the COVID-19 pandemic, rapid government-funded testing, tracing, and crucially, vaccination programs proved absolutely vital in controlling outbreaks. It was a stark reminder.
It really hammered home the state's responsibility, didn't it, to safeguard public health on a massive population-wide scale.
Absolutely. It demonstrated that some health challenges are just too big, too interconnected for anything other than a collective state-led response.
That's a powerful illustration of why we need that collective response. Individual action, while important, simply cannot organize a national vaccination campaign or implement widespread testing infrastructure.
No chance.
These are efforts that unequivocally require large-scale, coordinated governmental effort and resources, which naturally leads us to think, the government's role isn't just about stepping in when we're already sick, is it?
Not at all.
Our sources highlight how their most impactful work often happens long before illness even strikes.
Oh,
Through proactive prevention. It's like they're trying to stop the wave before it even hits the shore, right?
precisely. Governments possess a unique capacity, really, to implement large-scale preventive measures that are utterly beyond individual reach.
Like what, specifically?
Well, take public health campaigns, for example. The sources mention everything from anti-smoking initiatives, which have had a huge impact over decades,
Definitely.
to obesity awareness programs or campaigns promoting vaccination uptake. These aren't just simple flyers or ads. They're often sophisticated, multi-pronged campaigns.
Oh, so.
They're designed to educate entire communities, leveraging psychology, mass media, community outreach, maybe even policy changes like taxes on sugary drinks to subtly shift cultural norms and behaviors over time.
So the long game.
It's a very long game. Think about the dramatic decline in smoking rates in many developed nations over the last few decades. That didn't happen by accident.
No.
It was the result of sustained government campaigns, educational programs in schools, and significant policy changes like public smoking bans and advertising restrictions. The goal is always to reduce the overall burden on healthcare systems before illness even occurs.
Which makes sense. It's not only incredibly efficient in the long run, saving vast amounts of money on treatment, but it also improves quality of life for millions of people. They avoid the illness altogether.
Exactly. It's that upstream effort.
So it's a massive upstream effort aimed at transforming societal habits. And it goes even further than just education and campaigns, doesn't it? Our sources talk about infrastructure.
Absolutely. This
Yeah.
is fundamental. Our sources place a huge emphasis on physical infrastructure that is vital for health, things we often take completely for granted.
Like,
Clean water systems for every household. Think about the engineering and investment required for that. Stringent air quality regulations for industrial emissions, proper waste disposal and sanitation systems, maintaining safe public spaces like parks and playgrounds.
things that affect everyone, whether they think about it or not.
Precisely. These are crucial environmental factors that directly impact public health and are truly beyond individual control. You, as an individual, can't build a municipal water treatment plant or regulate the emissions from a factory across town.
Right. You rely on the government or some collective body to do that.
Yes. These require large-scale, coordinated governmental effort and significant, sustained financial investment to protect everyone. It's about ensuring that the very air we breathe and the water we drink don't become sources of illness.
That's a powerful argument for the government essentially setting the stage for health, making it possible, or at least easier, for people to thrive. But if we look at this from a critical lens, an argument against relying solely on personal responsibility starts to emerge here, doesn't it?
It does.
Our sources contend that simply telling people to make healthier choices often overlooks these deep-seated systemic barriers that make those choices incredibly difficult, if not impossible, for many people.
This really raises an important, sometimes uncomfortable question. What happens when the ideal of personal responsibility bumps up against the harsh reality of lived experience?
Exactly. So what are some of these barriers that fundamentally limit individual choice and agency, according to the research?
Well, our sources specifically point to poverty as a major one. And linked to that, a lack of access to healthy, affordable food.
The food desert idea.
Precisely. If you live in what's often called a food desert, it's not just that fresh, nutritious food might be expensive or simply unavailable locally. It's often that large supermarket chains have opted out of lower-income areas, perhaps due to perceived lower profit margins or higher operating costs. This leaves residents with maybe only convenience stores or fast food outlets nearby.
Where healthy options are limited and expensive.
Exactly. The cost of a healthy meal, calorie for calorie, can be astronomically high compared to calorie-dense processed options. Now, imagine you don't have a car or reliable public transport to reach a distant grocery store that does offer fresh produce.
It becomes almost impossible.
It forces residents into dietary choices that directly contribute to conditions like type 2 diabetes and obesity, even in children, simply because fresh, healthy food is literally out of reach both financially and geographically. It's not about desire, it's about access.
So what does this all mean for someone living in that kind of situation, a food desert maybe, or just more broadly, struggling to make ends meet? How can they truly prioritize their health with things like fresh food or finding safe spaces for exercise when their daily circumstances are so constrained? It feels like their personal desire is often just overridden by the daily battle for survival.
That's precisely the point the sources make. These systemic issues directly limit people's ability to maintain their health, regardless of their personal desire or their level of discipline. It's often not about a lack of will, it's about a lack of equitable opportunity.
Right.
Think about it. Without safe, well-maintained public parks or even just safe streets to walk on, how can someone consistently exercise, especially if they work odd hours? Without affordable, accessible childcare, how can a single parent find the time, let alone the energy, for preventative health screenings or even just a regular checkup?
These are very real barriers.
Very real. Therefore, from this perspective, government funding and intervention are seen as indispensable for creating equitable conditions that actually enable healthy living. It's about building a foundational environment where personal choices can actually translate into positive health outcomes for everyone, not just a privilege reserved for those with more resources or better circumstances.
That's a really powerful argument for the government's essential role in setting the stage, creating that healthy environment. But now, let's pivot. Let's look at the other side of this coin, a perspective that resonates deeply with many people. The power of personal agency and the case for individual accountability.
Okay, the counter perspective.
Yeah. Our sources present a compelling case here, too, asserting that personal choices are the undeniable, often primary foundation of good health.
Yeah.
This is a viewpoint many of us hear all the time, right? In wellness circles, public health messaging, even just in daily conversations.
It's absolutely a widely accepted truth, and, for good reason. Individual actions play a tremendous, often decisive role in our health outcomes. It's hard to argue against that.
So what are the key factors?
Our sources detail these key lifestyle factors that are almost entirely within an individual's control. The food we choose to eat, day in, day out, the amount and type of physical activity we engage in, how we manage stress, which is a huge one,
Huge.
and whether we abstain from harmful substances like tobacco or excessive alcohol. These aren't abstract concepts. They are daily decisions that collectively profoundly shape our health trajectory over a lifetime.
And it's not just about a general sense of well-being, feeling good day to day. These factors significantly influence the development of some of the most common and, frankly, most debilitating conditions we see today.
Exactly. We're talking about the epidemics of obesity, type 2 diabetes, various forms of heart disease, even some cancers. These aren't just random occurrences. The research shows they are often deeply, sometimes tragically, tied to the habits we cultivate or fail to cultivate every single day.
And the impact is quantifiable, isn't it?
Here's where it gets really interesting, the sheer statistical power of individual choices. This was an insight that genuinely surprised me from our sources, the scale of it.
Go on.
Our research highlights a powerful statistic often cited in major health studies. Regular physical activity and balanced nutrition can prevent up to 80% of premature heart disease cases.
80%.
Think about that for a moment, 80%. When you consider how much of our global healthcare spending goes into treating advanced heart disease, bypass surgeries, long-term medication, rehabilitation, managing complications, this statistic reveals a core inefficiency, doesn't it?
It really does. It's staggering.
It underscores the profound, almost revolutionary impact of what we choose to do with our bodies every day. This isn't just about feeling good, it's about potentially avoiding decades of chronic illness, avoiding costly and invasive medical interventions, and avoiding premature mortality. It puts a lot of power squarely in the individual's hands.
That statistic is truly eye-opening. It illustrates just how much control we can actually have over our long-term health outcomes. Now, if individuals proactively adopt these healthy habits, how does that benefit not just them personally, but the broader healthcare system? Beyond the obvious personal gains, what's the systemic advantage?
Well, the benefit of healthy habits extends far beyond the individual. It creates a tangible, positive externality, as economists would say, for society. Meaning, when people reduce their reliance on acute or chronic medical interventions, like consistently taking preventative steps, maintaining a healthy weight, exercising regularly, managing stress effectively, it directly eases the immense strain on public healthcare systems.
Okay. Less demand.
Exactly, less demand. These systems, even in the wealthiest nations, are often stretched incredibly thin. We hear about it constantly. Overflowing emergency rooms, long waiting times for specialist appointments, staff burnout, and a constant battle against rising costs.
Yeah, it seems like a universal problem.
It really does. So every individual who embraces healthier habits effectively reduces the demand for costly treatments and services. This, in turn, frees up resources, doctors' time, nurses' time, hospital beds, expensive equipment for those with unavoidable medical needs, like accidents or genetic conditions. It's a direct contribution to the collective good, to the sustainability of the system itself.
So it's not just a personal gain. It's a critical contribution to the overall efficiency and sustainability of our collective healthcare infrastructure. That makes sense. But this perspective also emphasizes that there are very real, very practical limits to what governments can actually force individuals to do, isn't there? You can legislate against certain things, maybe tax unhealthy products, but you can't really legislate wellness itself.
Absolutely. This viewpoint places a strong, maybe sometimes uncomfortable emphasis on personal agency and its limits. The argument is that while governments can regulate, educate, incentivize, maybe even nudge people towards healthier choices, they ultimately cannot force individuals to avoid unhealthy behaviors. Think about smoking, excessive alcohol consumption, or leading a completely sedentary lifestyle. These are deeply personal choices.
And often tied to complex factors like addiction or mental health.
Indeed. And critically, our sources remind us these behaviors are leading causes of preventable diseases worldwide. So while governments can create frameworks and offer support, the ultimate decision to engage in these behaviors or to abstain rests firmly with the individual.
And the impact of those decisions, both on personal health and on the spiraling costs absorbed by healthcare systems, is undeniably profound.
It's huge. You can't ignore it.
This brings us to another crucial point from our sources, how individual accountability promotes long-term sustainability for healthcare systems. It's an argument that looks beyond just easing the immediate strain and dives into the bigger picture of resource allocation and, frankly, national financial health.
Yeah, and what's fascinating here is the stark economic reality our sources lay bare. It's not just about feeling the pinch now, it's about whether the system can even survive long term.
How so?
Even in developed nations with seemingly robust healthcare systems, these systems are chronically overburdened. We hear about it constantly. Long waiting times for crucial surgeries, difficulty getting timely appointments with specialists, staff shortages leading to burnout, and escalating costs that threaten national budgets.
It feels unsustainable.
Exactly. This struggle to meet demand has significant human costs, delayed care, unnecessary suffering, and also huge economic costs, with resources constantly diverted to reactive treatment rather than, say, prevention or other societal needs.
So the argument goes, if individuals prioritize their personal health, if they proactively manage their lifestyle, it minimizes their need for costly and extensive medical interventions, right? And that, in turn, frees up those precious resources for other critical areas.
Precisely. By prioritizing personal health, individuals become less reliant on the healthcare system for conditions that often could have been prevented or significantly delayed. This drastically minimizes the need for expensive diagnostics, prolonged hospital stays, complex surgeries, long-term medications.
Okay.
And crucially, this frees up resources. It allows governments to allocate their often limited funds, their tax revenues, to critical areas where individual action is less impactful or entirely impossible.
Like what?
Think emergency care for unforeseen accidents or sudden critical illnesses, or the treatment of rare genetic diseases that require highly specialized and incredibly expensive research and ongoing interventions, or even just ensuring baseline care for unavoidable conditions of aging. It's about optimizing where the collective funds go.
Making sure the system can actually handle the things individuals can't control.
Exactly. Ensuring that the system can truly serve those who need it most for unavoidable reasons, rather than being perpetually overwhelmed by largely preventable conditions.
But this raises an important, maybe slightly controversial question. Does too much government support actually dilute our personal drive?
The moral hazard argument.
Yeah. Our sources present a critique of purely government-centric approaches, suggesting that an excessive reliance on public funding might inadvertently foster dependency. It might neglect the crucial role of self-discipline, of personal effort, in health maintenance. It's almost like if someone else is always there to catch you, fully insured, do you try as hard to avoid falling in the first place?
That's a valid and often debated point in health economics and policy circles. The argument suggests that if the system is always there, fully covering all costs regardless of lifestyle choices, it might remove some of the personal financial incentive to make healthier decisions. Why put in the effort to quit smoking or lose weight if the consequences are fully socialized?
It's a provocative thought.
It is. However, our sources immediately provide a crucial nuance here, a counter-critique to this line of thinking. It points out very strongly that this view often overlooks the fundamental fact that not all individuals have equal access to the resources needed to make those healthy choices in the first place.
So we're back to the systemic barriers again.
Exactly. It connects us right back to those systemic issues we discussed earlier: poverty, food deserts, lack of safe environments.
Right. It's easy for someone, maybe someone with a good income, access to a gym, fresh organic food, readily available, good health education.
Yeah.
It's easy for them to say, just eat healthy and exercise. But what if you don't have safe spaces for exercise in your neighborhood? What if the only affordable food options within reach are processed and unhealthy? What if you're working 2 minimum wage jobs just to pay rent and have absolutely no time or energy left to prepare healthy meals from scratch?
Exactly. How can personal responsibility truly flourish in those circumstances when the environment itself feels stacked against you? The counter-critique from the sources reminds us that while personal accountability is absolutely vital, it cannot exist in a vacuum.
It needs fertile ground.
It must be supported by an environment where those optimal choices are genuinely accessible and feasible for everyone, not just the privileged few. This shows how incredibly intertwined the debate really is. You simply can't fully separate individual choice from the societal context in which those choices are made.
It's a delicate and intricate dance, isn't it, between agency and environment?
It really is.
So we've navigated two incredibly compelling, almost clashing viewpoints. We've seen the robust arguments for collective government care and the equally powerful case for individual accountability. It leaves me wondering, is there truly a way to reconcile these powerful forces? Or are we destined to forever debate who holds the primary key to our health? What do our sources suggest about moving beyond this apparent stalemate?
That's the crucial pivot, isn't it? Moving towards a solution. And our analysis suggests that the most effective way forward isn't really about picking a side in that debate. It's about embracing what our sources describe as a truly synergistic approach. The core opinion that emerges, quite consistently actually, is that a balanced model is best, one that deeply integrates robust government support and empowered individual responsibility. That's seen as the most effective and sustainable way to promote health across society.
Synergistic, meaning the whole is greater than the sum of its parts.
Precisely. It moves beyond that binary either thinking and really embraces a more holistic, interconnected view of health where both elements are essential and actually reinforce each other.
So it's not about one or the other, but rather a dynamic, collaborative effort where both sides work in tandem. That feels like the aha moment, the key takeaway for you, our listener here. Let's dig into what that collaboration looks like in practice. Starting with the government's specific role in this synergistic framework, what are the actionable pillars of government support that our sources highlight?
Right. What should the government actually do in this model? Our sources meticulously outline specific areas for prioritization. First, universal healthcare access remains paramount. Ensuring everyone has a baseline of care, preventative screenings, essential treatments, emergency services without facing financial ruin. That's the safety net.
Okay, foundational.
Second, proactive preventive programs are absolutely crucial. Building on what we discussed earlier, large-scale efforts to stop illness before it starts rather than just reacting. This includes comprehensive immunization campaigns, strong public health education, robust disease surveillance systems.
I mean proactive, not reactive.
Exactly. And third, investing in the fundamental infrastructure that actively supports healthy living. This means things like creating and maintaining safe, accessible public parks and green spaces where communities can be active, ensuring reliable public transportation so people can get to jobs, grocery stores, and medical appointments, and enforcing stringent food safety regulations to protect consumers.
So tangible physical things that make health easier.
Yes. These are concrete, actionable pillars for government action that create the fertile ground, as you said, for health.
And it's not just about direct care or prevention. It's also about empowering individuals to make those healthier choices we talked about earlier. How can governments facilitate that without being overly prescriptive or, paternalistic?
That's a key balance to strike. They can do this by strategically creating an environment where healthy choices become the easier, more natural, perhaps even the default choices.
How?
This includes targeted educational campaigns that go beyond just basic facts. They need to delve into practical nutrition advice, how to cook healthy on a budget, for example, explain the benefits of different types of physical activity, offer accessible tools for effective stress management techniques.
Making the information practical and usable.
Yes, but it goes further. Governments can also offer powerful incentives. Things like subsidies for healthy foods, making fruits, vegetables, whole grains significantly more affordable and accessible to everyone, particularly those on lower incomes.
So leveling the playing field financially.
Exactly. Imagine fresh produce being consistently cheaper than processed snacks or sugary drinks. By implementing such policies, governments aren't forcing choices, but rather empowering individuals to make better choices by systematically reducing the barriers, both financial and informational, that often stand in the way of optimal health.
That makes perfect sense. Okay, so with that robust framework and supportive environment hopefully in place from the government, what then is the individual's ownership in this partnership? What's your part, listener, in this collaborative health journey?
Right, because it's definitely a two-way street. While the government provides the essential framework and supportive environment, individuals must still embrace that support and actively take ownership of their health. This means adopting sustainable lifestyle practices.
So the personal commitment is still vital.
Absolutely critical. It's about leveraging the support and opportunities provided, the parks, the information, the potentially subsidized healthy food to make informed, healthier daily decisions. Whether that's choosing to walk or cycle instead of drive, preparing a nutritious meal instead of getting takeout, prioritizing sleep, managing stress.
The day-to-day stuff.
Exactly. Without that personal buy-in and consistent effort, even the most well-designed government programs will inevitably fall short. You can lead a horse to water, as they say.
True. And our sources even give us some concrete, real-world examples of how this collaboration can actually work in practice, showing that it's not just a theoretical ideal.
They do, which is helpful. Workplace wellness programs are often cited as a prime example that can beautifully illustrate the synergy.
How do they work?
Well, these initiatives often combine government incentives, maybe tax breaks or grants for companies that offer comprehensive wellness programs with individual employee participation in health-promoting activities.
Like what kind of activities?
Things like on-site fitness classes or gym membership subsidies, access to nutritional counseling, smoking cessation support, or workshops on stress reduction and mental well-being.
So a joint effort between employer, employee, and maybe government incentives.
Exactly. Employers benefit from a healthier, potentially more productive workforce, and ideally, reduced healthcare insurance costs down the line. Employees benefit directly from improved health and well-being and having that supportive environment right at work. This illustrates how such partnerships can yield significant positive outcomes for multiple parties.
Healthier individuals, potentially lower costs for businesses and the government.
And ultimately, a reduced burden on the broader healthcare system. It benefits society as a whole when these partnerships work well.
Now, connecting back to some of those systemic inequalities we highlighted earlier, the food deserts, the lack of safe spaces, our sources really seem to double down on the idea that addressing these deeper issues is an absolutely crucial, non-negotiable step for achieving truly sustainable health outcomes for everyone.
Yes, this point comes through very strongly.
We simply cannot ignore the backdrop against which individuals are making their choices.
This is truly foundational. The argument is that governments must actively tackle the broad social determinants of health. These are the non-medical factors that profoundly influence health outcomes.
Remind us what they are again.
Things like poverty and income inequality, educational attainment levels, access to safe and affordable housing, stable employment opportunities, and exposure to clean environments versus pollution.
The big picture stuff.
The really big picture stuff. If people are constantly struggling with basic needs, worrying about eviction, working in unsafe conditions, breathing polluted air if they lack a quality education that fosters health literacy, or if they live in unsafe neighborhoods where they fear going outside,
then prioritizing health feels like a luxury they can't afford. Exactly. Their ability to realistically prioritize their well-being becomes incredibly challenging, if not impossible. So, creating environments where individuals can genuinely choose health means addressing these deeper societal issues first.
Yeah.
It requires recognizing that health is intrinsically linked to social justice and equity.
And that requires a very sensitive, very nuanced approach, doesn't it? Because while we want to empower and encourage personal accountability, we absolutely do not want to stigmatize or blame those individuals who are facing immense barriers, barriers that are often entirely beyond their personal control.
That's the delicate, ethical tightrope that public health initiatives have to walk. Our sources emphasize this repeatedly. Programs must be designed to encourage personal accountability without placing blame or inadvertently stigmatizing those who are facing significant systemic barriers.
How do you do that?
It's about framing it as support, empowerment, and creating accessible pathways to healthier choices, not judgment or moralizing. It requires understanding the diverse circumstances within a population and tailoring interventions accordingly. This inclusive approach is absolutely essential for and also significantly cuts down on the enormous economic costs associated with widespread ill health. When people are healthier, they are generally more productive, they can participate more fully in society, they live longer, more fulfilling lives, they require fewer costly medical interventions. The entire community benefits.
It sounds like a virtuous cycle.
It really is. It creates a virtuous, self-reinforcing cycle of well-being and prosperity. It's about building a healthier, more resilient future for everyone.
So as we wrap up this deep dive, it feels abundantly clear. While government-funded healthcare seems absolutely indispensable for ensuring equitable access and providing that crucial systemic support,
The foundation.
individual responsibility also remains vitally important for preventing disease where possible and promoting long-term well-being. It's definitely not one or the other.
No, it's a powerful dynamic combination. Our sources consistently point to this synergistic approach as the most comprehensive, most effective solution we have.
Synergy again.
Yes. This is where governments actively provide essential resources, education, and supportive environments. And individuals, empowered by that support, actively adopt and maintain healthy lifestyles to the best of their ability within those environments. It's truly a shared endeavor, a societal partnership.
And ultimately, by consciously balancing these responsibilities, by actively fostering this collaborative approach, societies can build healthcare systems that are not only resilient in the face of inevitable challenges like pandemics or aging populations, but also genuinely empower all citizens to lead healthier, more fulfilling, and more productive lives.
It's about creating an environment where health isn't just a lottery based on your circumstances,
Right.
but a shared pursuit where the conditions for health are universal and the opportunity for individual well-being is truly maximized for every single person.
Exactly. And that leaves us with a provocative thought for you, our listener, to mull over after this deep dive. Considering everything we've discussed today, the government's indispensable role in collective care and systemic support, and your own undeniable power through personal choice, what specific example of this balanced approach, this synergy, or perhaps a clear imbalance, do you see playing out in your own community, right where you live?
Think locally.
And thinking practically, what might be one small actionable step, maybe something you could do or something your community could advocate for that could move us just a little bit closer to this ideal partnership between collective support and individual empowerment?
Yeah, take a moment to reflect on your own experiences. Where do you see the system, the government, effectively supporting health? Where do you see individual actions making a profound difference?
Yeah.
And then, where are the gaps? Where are the missed opportunities for a more integrated, more synergistic approach? What could make it easier for people, including yourself, to make those healthy choices?
That's a powerful question to end on, one that invites real-world application of all these insights. Thank you for joining us on the deep dive. We hope you walk away feeling more informed, more empowered, and maybe ready to think critically about this vital topic in your own life and community.
Until next time.
We'll see you next time.